Hi, my name is Isla Abamonga. I use she, her, hers pronouns, and I'm currently a sophomore pursuing a dual degree in public health science and government and politics with a concentration in international relations. For my global public health practicum project, I worked as an advocacy and research fellow at the Fund for Global Health as a part of the Maryland team. Dr. Maring had sent out a flyer saying that they were accepting new applicants last year, and I was immediately interested. Before this year, I had no experience in the more socio-political aspects of public health, with my experience mainly being in the science aspects of the field. But over the course of my freshman year, I had realized that I was much more interested in the community building and policy side of public health, and was looking for experiences that would help me determine whether or not I was actually interested in that career-wise. Through my work with the fund, I've really been able to gain experience and hone in on my interests within the public health field, and I've solidified my interest in these areas, so much so that I had added international relations as a second degree. The Fund for Global Health is a philanthropic agency seeking change in specific global health indicators, working to provide the maximum possible health benefits to vulnerable communities. These indicators can vary each fiscal year, but during my time in the fund, we focused on three main health asks regarding tuberculosis, or TB, comprehensive primary health care, and accountability on the global scale. These were chosen because of the after effects of the COVID-19 pandemic and for these reasonings. Number one, TB is the leading infectious disease killer in the world, and it has lost funding with the pandemic, so we asked for a redistribution of funds to compensate. Number two, for comprehensive primary health care, oftentimes in humanitarian situations, a lack of quality primary health care can lead to negative effects in the healthcare system. With frontline workers being the first to recognize outbreaks, it is especially important to gain more funding to increase capabilities. And lastly, number three, we found that there are no requirements for outcome reporting to Congress, which can make it difficult to measure global health program effectiveness. So we asked for language changes within policy to make it a requirement. I worked on the Maryland team as a member of the Maryland constituency, advocating for different public health asks to our state senator, Senator Van Hollen, a member of the Senate State and Foreign Operations Subcommittee, or more commonly known as SFOPS. Each team works directly with their state's congressional members of the SFOPS subcommittee to bring about our asks in that fiscal year. During my time in the fund, I met virtually with my team of about 3 to 4 individuals, where we mainly worked on getting meetings with Senator Van Hollen staffers to advocate for our asks in the 2022 fiscal year, or FY22. This manifested in different ways, with us doing something different each week, ranging from rewriting laser talks where we aim to summarize and pitch our asks, to conducting research regarding our health system strengthening and our asks. Another portion of my internship was in our monthly conference calls with all fellows across the country. We would have guest speakers and the opportunity to ask questions to public health experts, which you can see in the graphic in the bottom left. Our main focus for much of my time, however, was planning a virtual forum meeting with Senator Van Hollen and other Maryland organizations to raise awareness to our public health asks for FY22. To the right of my poster, you can see the flyer of the event, which was the culmination of all of our hard work in setting this up. I was the main correspondent of the Maryland team, setting up meetings and securing our co-hosts for the event, which included MedChi, the Maryland State Medical Society, the Maryland Public Health Association, the Maryland Academy of Physician Assistants, and Public Health Beyond Borders at the University of Maryland College Park, along with Senator Van Hollen staffers. This was one of the only successful virtual forums of the fund for this year, and it was with a lot of hard work and effort that it had come to fruition. I tried to get a range of constituents that had questions for the senator, and this event really shined a light on the importance of interacting with our elected officials and the work it takes to initiate change within government. The government does not stop working even in the midst of a pandemic, and as citizens, we have the ability to create change. This experience really pushed me in terms of creativity and activism, showing me different avenues of advocacy and how it is possible to create change within the public health sphere. My practicum allowed me to gain experience in advocacy with government policy. In the future, I plan on working in international health policy, primarily focusing on intersectional policy regarding marginalized communities. And my time with the Fund for Global Health really showed how important it is to recognize what is occurring at the individual level and how small changes in policy can really cause a ripple effect of change. I would like to give a special thank you to Keith Johnson, the Director of Advocacy at the Fund, Michael Horlick, and Dr. Dayu Srinivasan, the Maryland team coaches at FFGH, and Haley Axton, my GPH faculty advisor. Thank you.